Okay. Assalamu alaikum, everyone.
Walaikum assalam.
Bismillahirrahmanirrahim. Quote of the day: work for a cause, not for applause. Live life to express, not to impress. Today, the topic of my presentation is sample size calculation for analytical studies. Learning outlines. What is analytical study? What are observational studies? Sample size calculation of cohort study, sample size calculation of case control study. Learning objectives. At the end of presentation, participants will be able to determine sample size of analytical study. Now, what is analytical study? An analytical or comparative study attempts to establish association or determine risk factors for certain problems. This is done by comparing two or more groups with or without the outcome of interest or exposure of interest. It includes observational studies, experimental studies. In my next presentation, I will discuss sample size calculation of experimental studies. Today, my main focus is on observational studies. Now, observational studies, these are the studies that do not have any control over exposures. Rather, they simply observe what happens to a group of people. It also examines the association between risk factors and outcomes. These studies include cohort and case control. Now, cohort study. A cohort study is a particular form of longitudinal study that samples a cohort, a group of people who share a defining characteristic, typically those who experienced a common event in a selected period, such as birth or graduation, performing a cross-section at intervals through time. The cohort is usually disease-free, and we observe it for some time and to look for disease and not disease. Like in a cohort study, you identify who are currently disease free. Then among them, you identify those with and without the exposure or risk factor. Then this cohort is followed up for a predetermined amount of time to identify those who developed the disease and those who did not. Sample size calculation for two groups. There are different ways like this for two groups are dependent on different study designs. The sample size for any study depends upon acceptable level of significance, power of study, expected effect size, underlying event rate in population, standard deviation in population, allowable error. These parameters I've already discussed in my previous presentation. Now, sample size calculation of cohort study. This is the example. We want to prove that overweight adults have high risk of diabetes mellitus compared to normal weight adults. Now, from the literature review, we get the following data. Now, identify the rate of disease among those with and without the risk factor. So, ratio of unexposed vs exposed is 1:1. Proportion of sample from no risk population is 50%. Proportion of sample from at risk, that is overweight population, is 50%. P1 is true proportion of diabetes mellitus in normal population, that is 7%. And P2, true proportion of diabetes mellitus in overweight population, that is 32%. Again, here we can see that in overweight, the proportion of diabetes who developed diabetes mellitus is 32%, and who did not, it is 68%. And among normal population, those who developed diabetes mellitus is 7%, and those who did not is 93%. And this is the data we get from our literature review. Now we use the formula, that is Flees formula. This is Flees formula that is commonly used for sample size calculation of cohort studies. Here M is used, that is N1, size of sample from population 1, and 2, size of sample from population 2. Because we have two groups, so there are two populations. So N1 is for population 1 and 2 is for population 2. P1 is proportion of disease in population 1 and P2 is proportion of disease in population 2. Alpha significance, that is 0.05, beta that is chance of not detecting a difference is 0.2, and power is 1 minus beta, that is 1 minus 0.2, and we get the power 0.8. R is n2 over n1, that is sample size of population 1 over sample size of population 2, and it is usually 1. And then we get p1 plus r p2 bracket r1 plus r plus 1, and q, we also use this parameter in the formula, that is q, and we get it by 1 minus p. So n1 is m, and 2 sample size of population 2 we get through multiplying the sample size of population 1 with r, that is ratio of cases to control. From table A2 in fleas, if 1A is 0.95, then this value is 1.960. If 1 minus beta is 0.80, then this C1 minus beta is minus 0.842. So we have seen earlier that proportion of sample from population 1 is 7% or 0.07, and proportion of sample from population 2 is 32%, and the ratio is 1 over 1 because we have equal number of cases, cases and controls. So applying all these values, we get this population P, and then Q we get by 1 minus P. So applying all these values in the fleas formula, we get this figure. So sample size of population 1 is 46, and sample size of population 2 we get by multiplying R multiplied by M, that is N1, and we get 46. So adding both, we get 92. So by calculating manually, we shall need a sample size of 46 each for both groups, for total of 92.7. Now case control study. In case control study, we identify the cases and controls, then we compare the rate of exposure risk factor between the cases and control group. In this study, disease has already occurred and we go back to see the history for exposure and non-exposure. Now sample size calculation. We want to prove that cataract patients, that is cases, have a higher rate of diabetes mellitus compared to patients with normal vision, that is controls. From literature review, we identify the rate of exposure among cases, that is 50%, and among the control, that is 8%. So we decide on the ratio, that is 1:1. From literature review, we get this data: proportion of sample from controls, that is normal population 50%, proportion of sample from cases, cataract population 50%. P1 is true proportion of diabetes mellitus in controls, or you can say normal population, it is 8%. P2, true proportion of diabetes mellitus in cases, cataract population, that is 50%. Again, here we can see that among cataract patients, those who had the who developed diabetes mellitus, they were 50%, and those who did not, they were also 50%. And among the population of people with normal vision, those who developed diabetes mellitus, it was 8%, and those who did not, they were 92%. Now again, we use this formula, that is Flee's formula, where again n1 is size of sample from population 1, n2 size of sample from population 2, p1 is proportion of exposure in population 1, p2 proportion of exposure in population 2, alpha significance is 0.05, beta 0.2, and power is 0.8, that is we calculated by 1 minus beta. R is n2 over n1, ratio of cases to controls. This is the value of P, and here we Q, that is we get by 1 minus P, and 1 is M, as it is shown in the formula, M is used, and N2 is we get by multiplying R into M. Now putting all these values, this is P1, that is proportion of exposure from population 1, that was 8%, that is 0.08, and P2 is 0.5. Since we have equal number of cases and controls, so R is 1/1. Applying all these values, we get this figure 21.5. So N1 is 22 and N2 we get R into M. R was 1, so our N2 is also 22, and adding both we get 44. So we need a sample size of only 22 cases and 22 controls. Now the formula for sample size calculation for case control study design also depends on type of variable, that is qualitative or quantitative. Conveniently and usually we use Fleece formula, but these formulas are also used. For qualitative variable, this formula is used. An example is, suppose a researcher wants to see the link between childhood sexual abuse with psychiatric disorder in adulthood. He will take a sample of adult persons with psychiatric disorder and will take another sample of normal adults with no disorder. He will then go retrospectively to see history of childhood in both groups. Exposure to both groups will be compared and odds ratio will be calculated. Here, number of people exposed to childhood sexual abuse, qualitative variable. Hence, the formula used will be in this, where R is ratio of control to cases. We usually use 1 for equal number of case and control. P, average proportion exposed and proportion of, and this is the sum of proportion of exposed cases and proportion of control exposed over 2. Standard deviation, Z beta, standard normal variate for power, that is 80%. For 80% power, it is 0.84, and for 90% value, it is 1.28. And researcher has to select this power for the study, and usually researchers take it as 80%. And then standard normal variate for level of significance. Then P1 minus P2, effect size or different in proportion expected based on previous studies. P1 is proportion in cases and P2 is proportion in control. So in the example, we assume that power is 80%, expected proportion in case group is 0.35, and expected proportion in control group is 0.20. So applying these values in the formula, we get the sample size of 138.9. Since researcher wants to take equal number of subjects for cases and control, so he needs to recruit 138 subjects in each group. For quantitative variable, we use this formula. For example, suppose a researcher wants to see the association between birth weight and diabetes in adulthood. The birth weight being a quantitative data, the researcher will select one group, that is cases, that will be diabetic adults, and other group, that is control, will be non-diabetic adults. Both groups will be traced back for data regarding childhood weight. And then using this formula, where SD is standard deviation, researcher takes its value from previously published studies. D is expected mean difference between case and control. Assuming D is 250 grams, standard deviation 1 kg, power 80%, and equal number of cases and controls. Using this formula, we get the sample size of 250. Hence, researcher has to take 250 subjects in each group, that is case and control. Now coming to MCQs. MCQ number 1. A researcher wants to see the impact of weight training exercise on cardiovascular mortality, for which he selects two groups, one consisting of those who exercise and others who do not. According to previous studies, proportion of cardiovascular death in case may be around 20%, and in control it is around 40%. Hence, sample size for 5% of significance level and 80% power with equal number of cases and controls will be. These are the choices: 59, 84, 101, 1.8. Correct answer is 118. This is how we calculate. We calculate using this Fleece formula. That is, N1 is size of sample from population 1. P1 is proportion of disease in population 1, that is 0.2. As I have mentioned, this 20%. Proportion of cardiovascular death in case is 20%, and in control it is around 40%. So P2 will be 0.4. Significance is 0.05, power is 0.8. If 1 minus beta is 0.80, then the C1 minus B is 0.842, and 2 is size of sample for from population 2. P2 is proportion of disease in population 2, that is 0.4. Beta chance of not detecting a difference, it is 0.2, and R is 1 because ratio of cases to controls is 1. So applying all these values, we get 59. That is 59 subjects in each group, and total we will get 118. A researcher wants to see link between childhood abuse and mental illness in adulthood. He will take a sample of adult persons with mental disorder and will take another sample of normal adults and will go back to see history of childhood abuse. Exposure to both groups will be compared. He will calculate sample size by the following formula: Fleece formula, Yaman's formula, Caution's formula, Solvent's formula.
Fleece formula.
Yes. The right answer is Fleece formula. A pediatrician wants to study association between the use of tap water for drinking and diarrhea, for which children who are suffering from diarrhea will, because while those not having diarrhea will be controls. Their medical records are consulted regarding past exposure to risk factors. He can calculate the sample size for both groups using the following formula. These are the different formula. So
A.
any guess about the right option?
A.
Yes, A is right answer because it is for qualitative variable, and B is for quantitative variable, and C and D are formula used in cross-sectional studies. So this is a key, and here is the reference, and here I end my presentation.
Thank you very much. Very nice presentation. Actually, the sample size calculation is a very important and essential component of the postgraduate research, as well as for the point of view of practical applications and from the examination point of view. As far as the tip of the day is concerned, I will like to request you that the students must know at least three formulas. One for the descriptive studies, that is, as we know, is d square p
Yeah,
1 minus p divided by d square.
please.
The second important formula, that is for the analytical studies, that is also valid for experimental studies. So for analytical and experimental studies, you just have to see what is the type of variable that is under study. If it is in the form of proportions or it is a qualitative variable, Fleece formula is used. And if it is quantitative variable, then the formula based on standard deviation is used. If you know these three formulae in your whole academic studies or in your academic period, they are suffice, and they are well for your calculations of any of the study type, because most of the study types, they are either descriptive or analytical or experimental. So these three formulae would help you out in every situation. So I would request each and every person to know these three formulae, and also practice them so well that they can calculate it even if the software is not available. So my question is from Dr. Meha, is about the softwares. What are the softwares that are used for calculating the sample size?
Ma'am, RawSoft, AppyTools. Actually, I have my next presentation on experimental studies. Then after that, I have separate presentation on software usage. So meanwhile, I just know the names. Then In that I will discuss it in detail, that how will we use sample size, calculate sample size using that form, that softwares.
Okay, thank you. Actually, right. So I would ask these questions in your next presentation. However,
Sure.
just to remind you about certain important things is that in most of the experimental studies, there are same formulae as for analytical studies. So the Flees formula and the formula based on standard deviation, they also hold good for experimental studies. Next is about the software. There is two important softwares that are being used. One is RAWSoft, that is more for descriptive studies. However, if it is used for comparisons and for comparative cross-sectional analytical studies, it is not a very good software for calculating those sample sizes. The
Okay.
second very important software is WHO sample size calculator. It has many formulae in it. Even in each formulae, there are many examples have been given, tables have been given, how it has to be used, and it is one of the most useful and most informative software. This software not only gives the correct software sample size, but also give you the correct tutorials and training for calculating the sample size. The third sample size calculator is that is frequently used is EpiInfo sample size calculator. It is again a very nice calculator. However, it has certain limitations. It is good for descriptive studies and analytical studies. However, sometimes it is not giving us the options to calculate certain samples, especially if the sensitivity and specificity of certain tests are involved. However, the WHO calculator helps us in even sample size calculation when we have to base when we have to base it on the comparison of a lab test with the gold standard, or when the sensitivity or specificity of any sample or any test is concerned. It is mostly used for diagnostic tests. So this is the overview how the different softwares they have been used in experimental studies. Yes, they are important. There are many formulae, but if you know the three formulae that we have discussed today, the z square p 1 minus p by d square, and second about the Flees formula, and the third formula that is based on standard deviation. The whole experimental study designs, they are being covered in all these formulae. So thank you very much.
Ma'am, can we easily download WHO sample size calculator?
No, it is a purchased one. You can't get a free copy. However, uh, you must have to purchase this software, right?
Okay. Okay, ma'am.
Okay. So,
Thank you.
Allah Hafiz.
Allah Hafiz.
Any other question?
No, ma'am.
Okay, Allah Hafiz.
Allah Hafiz. Thank you.